We disagree strenuously with the report that was put out.
I strenuously object. Is that how it works? Objection. Overruled. No. No, I strenuously object. Oh, wow. Strenuously object, and I should take some time to reconsider.
Perhaps he might want to do that. Steve Rattner has been crunching the CBO numbers for you. Steve, what did you find?
Well, he can object strenuously or otherwise, but the numbers are what the numbers are. And so to start with who's going to lose their health care, you mentioned the 24 million number. Let's just break that down a little bit. So from the total of 24 million that you can see here in 2026, they're going to lose 14 million of these are going to be lost from Medicaid, both from regular Medicaid and particularly from this expanded Medicaid that President Obama, put in place. And these are amongst the poorest Americans. About 3 million who buy them on the so-called exchanges now will lose their insurance. And here's something maybe a little bit surprising, but about 7 million people will actually lose employer-based insurance under this, in part because they're removing the mandate on employers to provide insurance. And the impact of this by 2026, can we just go back to the previous chart for 1 second? The impact on this by 2026 will be to take the uninsured rate, which went all the way down to 10% from up in the 18% range, back to 19%, so all the way back from where we came. If you then look at the next chart, you can see that the tax credits that President Trump is offering are not really a substitute for the subsidies that Obama offered. And let me illustrate this with somebody with $26,500 of income, a lower income person in 2026. You can see that they would have gotten under Obama a subsidy here of about $12,600. They're now going to get a tax credit of about $4,500, so not nearly enough if you're 60 years old to pay for your insurance. And the same is true to lesser degrees at lower ages. By contrast, if you make $68,000, you're going to get the same exact tax credits. You would not have gotten a subsidy under Obamacare because it was deemed that Obamacare was not, subsidies were not needed for you to pay for your health insurance. So bringing this all together is really perhaps the most remarkable example of how they're in effect taking money from less well-off people and giving it to more well-off people. They're talking about $880 million of Medicaid cuts, another $675 million to end the AHCA subsidies. They're giving back about $542 million through their own tax credits. But the bottom line is a net cut of $1.1 trillion in health care assistance for people of lower incomes and for the poor. And against that, they're cutting taxes by $785 billion, the vast preponderance of that going to people making over $250,000 and to businesses, all of it really going to those groups. That's how they get the reduction, the deficit, essentially by cutting what you're giving to the less well-off people, giving a good bit of it back to rich people, and you end up with a little bit of deficit reduction.
Okay. Steve, thank you. Mark Halprin, the CBO is nonpartisan, correct?
It is.
It is. Okay, so the numbers that are being crunched out by the CBO show that President Trump's health care plan gives tax cuts to the rich and takes away health care from the very people who voted for him.
The power
of
Steve's charts are, those are facts that can't be disputed. They can dispute the CBO's coverage numbers, the number of people that lose coverage, in part because they say we're doing other things besides just this one bill that will create a market that will allow more people to be covered. They can make that argument, but it's going to be tough because the number's so high of people who lose coverage. Steve's numbers regarding who gets hit, who the losers are. We've been asking this question here on the program to every Republican. Who are the losers? Steve's charts show you who the losers are. Older people, people who are going to pay much more in the short term at least. And there's no way around that. You marry that up with the fact that rich people are going to get a huge tax cut, and something's going to have to give. This is not politically sellable going forward.
I'm not sure. Why would a Republican sell this? I mean, aren't they going to get voted out of office?
Well, they have a vision of how the healthcare market should work that requires radical changes, not just from the Affordable Care Act, but this would be a radical change from the system that existed before we had the Affordable Care Act. That's what they've run on for 8 years. They're determined to do it. They've got a chance now to try to sell the country on a different system, but they're going to have to be honest about the people who are losers, because again, Steve's charts are not disputable.
Right. Okay. Still ahead on Morning Joe.
With all due respect to our speaker, he and I must have read different scripture. The one that I read calls on us to feed the hungry, to clothe the naked, to shelter the homeless, and to comfort the sick. It reminds us that we are judged not by how we treat the powerful, but by how we care for the least among us.
Congressman Joe Kennedy, the grandson of RFK, calling out the House Speaker for describing the Republican health care bill as a, quote, act of mercy. He joins us straight ahead. And